Baby boomers age, we're experiencing more aches and pains, and some are resulting in surgery to replace worn-out parts. There have been advances in treatments for hip replacement, and this afternoon, Dr. Jason Weisstein of Boca Raton Regional Hospital joins us to answer your questions. Nice to have you with us.
Thank you very much.
Do you have any statistics on the number of hip replacements that are being conducted these days, and is it getting to be a younger population?
Yeah, it certainly is getting to be a younger population. In the United States, about 300 to 400,000 new hips are done every year.
What's the anterior approach to hip replacement?
So the anterior approach to hip replacement is a surgical approach where the patient lies on their back, and it's been touted as a muscle-sparing approach compared to traditional hip replacement that basically can go through muscles as opposed to going between muscles.
What are current hip replacements made of? What's put in my body?
So that's a fairly involved question in that there are a variety of things that can be used. Most of the implants on the thigh bone side involve cobalt or titanium, and then the socket is often a combination of plastic, sometimes ceramic, and sometimes metal.
How long do they last?
That's a great question because current research is trying to identify those implants that last the longest because that would be desirable. Most implants last anywhere from 15 to 20 years. Some of the newer implants are touted to do better than that.
And with a younger population going through this, it's important to see how long they last. If they can last a lifetime. It used to be an older person had a hip replacement and they did last a lifetime, but not so much anymore.
That's right, and so exactly what you're saying. So that's why the technology is really focused on coming up with the ideal implants so that they can last a longer time. The demands of the patients are just becoming increasingly more complex, and they want their implants to last their whole life.
What is the mini hip procedure?
So the mini hip procedure it's a poorly defined phrase, and the reality is that some people use that phrase to define a small incision. Some people use that to define a procedure that does less trauma to the soft tissues.
We're almost out of time, but I know, and I have a friend who had hip replacement surgery, the recovery is long. But it seems to be better these days in terms of you're not in pain as long, you get to be a little more active sooner, meaning, albeit a slower definition of active, but this is all helping to make it a better procedure for patients, isn't it?
That's right, and much of the focus nowadays is on what we call preemptive analgesia. So patients tend to have their pain control even before they start surgery, and so they can recover faster and participate in therapy to get them back up to speed more quickly.
Thank you for the information. Dr. Jason Weisstein is sponsored and brought to us today by Boca Raton Regional Hospital, which also underwrites our Ask the Doctor segment. We're back with more in just a moment.